number one. Number two, I've been fighting diabetes for 25 years, and in the past 7 days, I've had count them, three oral surgeries. So I want to personally thank publicly allopathic medicine, Dr. DeBakey, Dr. Joslin, and God, those wonderful people that invented Novocaine and Lortab. My gosh. I'm duty-bound to talk about someone asked about the top 3 ethical concerns about electronic communication, and this is what I think they are, because these things led to 2 of the laws I'm going to talk about. One is the patient consent to release the information. We haven't done a good job of paying attention to that. Second thing is protection systems for accidental release of the information to folks who shouldn't have it. That's a huge problem. And the last thing is what I call overcoming past myths. And those are things like, what is next of kin? Because we'll do a lot of things for next of kin, but doggone if I know who they are. What it is that you're mandated to report, and what it is you report because it's traditionally what you did. And then the other thing is the use of medical data for research purposes. That's changed a lot, and most physicians are not aware of what those rules are. And then the third thing is the objectives that we're going to try to achieve today. I've told the Medical Association that you'll be able to identify federal and state laws that apply to confidentiality. We'll jump to the chase. The federal law is HIPAA. There are 2 state laws, actually. One is a statutory law that's called the Physician-Patient Records Act, and I'll talk about that. The other thing is a common law in South Carolina, and this has been around since at least the 1930s, and that is that there is an absolute duty of confidentiality between physicians and patients, period. And most people don't know about that, and that predates HIPAA by about 50 years. And then the last thing was to discuss allowed and prohibited uses. The allowed use under HIPAA is basically you can use it for payment reasons, for treatment reasons, or for operations of the healthcare entity. There are no other exceptions other than that. For state law, there is no exception to the general duty of confidentiality, and the only exemption to the state law that says that patients must sign in writing the release for medical information. It only applies to where the physician is communicating with other physicians about the current treatment of that patient, or where the physician is communicating with an insurance company about getting paid. Okay? So now you can duck out if you want to, because that's pretty much the deal. Whoops. Can I get back from there? I promise never to do that again. Okay, first thing we're going to talk about is HIPAA. Do you guys know where HIPAA came from? Whose idea was HIPAA? Who? The American Medical Association. Here's why. Did you guys ever get one of those fancy prescription pads, had your name printed on it, it was beautiful, and on the back it happened to accidentally have a barcode? The pharmaceutical companies started tracking your prescribing practices, and docs got really irritated about it. So the answer was, we need some sort of law that says patients need to authorize this kind of disclosure. And that floated around Congress for a long time, but pretty powerful lobby on the other side, because guess who was selling that stuff? Pharmacies. And worse than that, it's easy to pick on Walgreens and CVS, but have you heard of these animals called pharmacy benefit managers? Caremark and those guys? That's who was making the big bucks on it. Because they literally had thousands of pharmacies reporting that data in. So people all across the country knew what you were doing. So physicians reacted to it, came up with this idea that said, stop this. In the meantime, you had this wacky president named Bill Clinton who was trying to say health insurance ought to be portable. If you go from job A to job B, you ought to be able to take your insurance with you and not have to suffer through all those filtering mechanisms to screen out people who are sick coming to work for you. That was the portability and availability part of HIPAA. So, you know, the way Congress is working these days, you get a bill passed in the Senate, then you get a bill passed in the House. At the federal level, we'll have a reconciliation bill. So in the reconciliation bill, that old notion of stop selling this stuff became a part of that law, okay? And the other thing that went with a lot of security measures about people who are keeping electronic formatted health information. And remember, that's all HIPAA applied to. It applied to folks who are keeping information about their patients in some sort of electronic means, okay? And the only way the feds could do anything about who was using that information was to say, if you broke these rules, we'll fine you from a civil justice standpoint. HIPAA is actually enforced by the Justice Department. So that's who the HIPAA police is. Okay, so that's how we got it. Now the thing I want to talk about today, just you can raise your hand or not, but how many of you use smartphones in your practice or iPads? How many of you have ever sent information about your patient to, say, a pharmacy using your smartphone? Or send information back to your office using a smartphone? Or how many of you ever used an iPad to send an electronic prescription? Okay? Chances are you violated HIPAA. And here's why. First, HIPAA requires specific written permission from the patient to release to anybody personal health information. And personal health information is broadly defined. It's almost any fact that has to do with the patient's diagnosis, treatment, the fact they were in your office, their demographic data, where they live, what zip code they're in, what their phone number is. All that's protected health information. If you look at Dr. Limehouse's presentation, that had those 16 things that have to be stripped out of data, if you're going to call it de-identified, those are the things that essentially irritated people into passing HIPAA. So that's why we're doing it. The only exception to that written rule is, like I said, for treatment of the patient, for payment to the covered entity, or for operation of the covered entity. That's it. So let me ask you something. There's a lot of talk now about doing quality studies in hospitals. Does that require IRB approval? Come on. Well, it depends on whether you're going to systematically collect the data for the purpose of contributing to generalizable knowledge. Because what is that? That's the federal definition of research. And if you do that, you have to have it approved by an IRB. Okay? A lot of you might accidentally be breaking that one. You ever do retrospective studies of patients and just go to your handy-dandy computer and screen the guys you want to look for and take that data and say, okay, I'm going to forget that patient's name, and now I have de-identified data? True or false? Absolutely false. The researcher can't be the person that identifies the data because you have to destroy the underlying facts that you use to create that data. And that, in most cases, would mean you got to go destroy the medical records you used. Okay. These security standards that are in place in HIPAA were recently fortified with a law called HITECH. Have you guys heard of HITECH? Yeah, I like that. All right, so HITECH increased what the computer standards are for how you digitally secure this information. And they also figured out that $100 a pop is not much of a sting for somebody that intentionally violates HIPAA. So they've raised the penalties now to up to $10,000 per release. Okay? And you guys ever read the Greenville News? Yeah? No? Any cool story lately about the hospital system? Employee working there decides they're going to breach the security system and take home 10,000 names. Remember this? Yeah, so a hospital worker breached their computer system, got names, addresses, telephone numbers, diagnostic states of patients, and they discovered it after about 4 weeks, and they arrested her, took her down to jail. She made bond, and guess where she went the next day? Back to work at the hospital system. Smart lady, dumb hospital. I say that respectfully, they're my client. But with all those employees, it's hard to know who's stealing and who's not. Okay, business associates. You guys know who these are? Business associates come into your office and they clean up, they do your accounting, they do your legal work, and they often have access to your protected health information. What are you supposed to do with these guys? Trick them, yeah. You're supposed to have a contract with them that lets them know that they have a duty to not, A, look at the protected health information, and B, not to disclose it, and C, what you're going to do to them if they do that. Okay, and that's called a business associate agreement. Well, the reason I'm going through this is because I'm going to talk about a bunch of ways that we might be communicating electronically. And I want to talk about how that works in light of the HIPAA standards that say that if you have any electronic device that's being used in that chain of information being transmitted from one piece to another, then you have to comply with these security standards, which basically require something called 128-bit encryption. Y'all know what that is? It's basically a way of playing with the signal so that it's not a sheer digital signal. And it's also never the same. Okay? Now, are iPhones encrypted? No. Is your system encrypted if you're using Verizon to send that information to the pharmacy? No. Not at 128 bits. It's encrypted for Verizon's purpose. Okay? So iPads, iPhones, other smartphones probably don't meet this standard. So if we talk about specific services like Yahoo or Hotmail or Gmail that you might use on a portable computer or a laptop or even on a desktop, they don't have that kind of encryption either for this information. So if you're in a system that you've purchased, the question you need to ask your vendor is this equipment going to be encrypted at 128 bits, and can you guarantee that for me? Because if not, you've bought a system that you know is not HIPAA compliant. The other thing I want to talk about is some issues with email in particular. This issue of authentication, do you know what I'm talking about? How do you know that the email that you're sending is actually going to the person you think it's going to? How do you know that? If you send me an email, if I give you my email address, you send it today, how do you know that it's going to me? You don't, okay? So what authentication is about is trying to come up with some system where the patient is involved in telling you, this is my email address, and this is not my company's computer, this is my computer. It's not my wife's computer, it's not my child's computer, so that you know that you're getting what kind of transmission? A confidential transmission that based on the information the patient gave you. And I have some suggestions for an authentication form. Completeness of the conversation. Email has turned into this kind of weird shorthand that really is dependent just on the two people who are communicating. And so often the context of that email is not what you think it might be, because people tend to use abbreviations and shortcuts when they're sending email messages, and patients are often not going to pick up on what you're abbreviating. So that's a problem with email. And the other thing is, like I say, the physical location of the recipient. Or do the spouses share the computer and you've got a message about some disease that's not necessarily an STD, but it's, I guess, an STE, a sexually treatable and embarrassing disease. And then probably the worst thing you can do, you guys never use instant messaging, do you? I mean, none of you guys are on Facebook, I hope. I mean, the most insecure device out there. And if you happen to use instant message, because you know what the stuff basically is. When you walk around with a smartphone, what do you really have in your hand? A radio. And how many frequencies are there for the millions of radios we're walking around with? About 12. So I can go outside right now and listen to conversations, find out all kinds of stuff if I'm sneaky and deviant enough to do it. So far, the price is not right. Text messages, horrible devices, okay? Unless you're on a system that you've designed the encryption for, or that your hospital, some hospitals have unified systems where they're all using some central server to route all the sensitive information, and they have ensured that they're encrypted appropriately. So that's okay, but if you're just using some sort of text message on your smartphone, all you're doing is sending a radio blast out to any fool who wants to intercept it. You just hope one of those fools is the patient. But other than that, it's making that a public document in effect. And there's a way to authenticate those things too, and it'd be just like you would do email. You would ask the patient for how they do instant messaging, where it's going to be, is it a phone that they carry all the time? You have the same issue with the completeness of the communication, because of all things that are abbreviated and cut up, and there's weird shorthand for, is text messages, right? And the other thing is that those messages, essentially, before they go to whoever you're sending it to, they go to a router somewhere, where that router then relays all the way down those maybe 5, 10, 30 cell towers till it gets to your intended recipient, okay? And at each level capable of being intercepted. The thing I want you to remember is that most text messages never die. What happens when you delete a file, say, in any Microsoft format? What physically happens? Dr. Eisenhower? Knock out the first letter of whatever you've named it. That's all you do. And there are 10 million forensic computer people who can make all those pictures come back like that. So be aware. And they never go away because they're either going to be sitting in your memory on your handheld or they're going to be sitting in the memory of that server. In addition, you need to know something about a fairly new law that passed a couple of years. It's generally referred to as e-discovery. Have you guys ever heard of that? Guess what was happening in the legal world? When we'd try to do discovery, we'd want to go see the email from, I don't know, maybe the governor. And all those messages would be deleted from the server. So we had to go physically get those computers, pay a ton of money to have all that reconstructed. So the feds passed a law that said you've got to have a written plan for how you destroy your data. And there's got to be a minimum time to keep it, generally 6 years, because it ties in with some IRS rules about audits. And you've got to have a written policy for how you destroy data that you're storing on computers. So that if we go to the governor and she says, I destroyed it, we got to see if it fits the policy. She wouldn't say that, but if that happened. So and lawyers can give you a real hard time about this because even though this passed 5 years ago, a lot of people still don't know about this law. How many of you run your own computer system in the office? How many, you got one person? How many of you use it from a vendor? Have you ever asked your vendor these questions? You ever looked in the contract you signed with that vendor to pay him $10 zillion a month where it says, yeah, we'll take care of this for you? I'll bet you that 90% of the contracts you've got say, we accept no responsibility for the security of that data. And we certainly will not pay damages. All we represent to you is that if you push 2 + 2 in our software, chances are you'll get 4. But that's all they guarantee. Telephonic communication. Do you guys call up patients and talk to them about their medical issues? Yeah. There's nothing secure anymore about even landlines because most landlines now have breaks in them that are microwave transmitters. So it might be a landline for 100, 150 feet. Then it's a big old radio. And the worst thing you can do is leave a phone message. Hi, this is Dr. Bullard. I'm calling about your HIV status. Not good. And apparently, Dr. Bullard will only call you about your Viagra status. Well, I think you got to think about the physical act of how voice messages work, okay? You call me to say, once again, your A1C is 32. And my friend who constantly monitors this is outraged that I've been saying it's down to 6. And because diabetics will do that. So the thing is with phone messages, you might get someone who said, yeah, I authorized you to call me. I didn't authorize you to call that message and leave it for that awful friend of mine. So if you've got to feel comfortable that whatever system you've worked out with the patient for leaving a voice message completely translates to the patient that if the wrong person gets it, it's their own fault. That's not your fault because you can't control it once it's on that machine. Especially if they forget to erase it. It's just a dangerous way to do it, I think. Social media. I hope we don't have to talk about this. Surely you guys don't use Facebook, unless you're out there stalking or something like that. In Facebook messaging is an instant radio. It's a direct connection to the IP address of the person that you're trying to message. And it generally just flies over the public airways until it gets there. The the actual radio frequency that those things are operating on are just slightly in between AM and FM. So it doesn't take much creativity to turn your FM tuner into a cell phone listener. Okay, this is my ideas for how to do an authorization form, and these are things you ought to try to get some kind of identifying information, like date of birth, social security number, at least the last 4 digits of it, what their insurance policy number is, a photo ID, what info specifically they want released, what their street address is, telephone, email address, and their signature. And we have a lot of issues with folks who are coming in with patients where the patient has dementia, some organic brain problem, they can't communicate very well. You need to follow their legally authorized representative, which is basically laid out in something called the Adult Health Care Consent Act that I know y'all know well. And somebody ought to witness that the patient was involved in giving you that information. You don't want your nurse to come in and sign that she's a witness. You want your nurse to hear you get this information from the patient. Yes? All right, let's think about this analytically. When we started, I said there were 3 laws that said that you can't release that information without certain things. So it's always going to be your liability. Okay? Kind of authorization. There is a HIPAA authorization form that I think you might be talking about. It says, I, Steve, authorize you, doctor, to disclose information about my diabetes status to the pharmacy. Okay? And that's going to be required under HIPAA. What I'm suggesting here is this is the form that you would have in the patient's chart. It says you have listed this information for the purpose of electronic communication with the patient. Instances of known or suspected abuse of a vulnerable adult have to be reported to DSS or the police. Emergency rooms have to report shotgun wounds. I'm sorry, gunshot. I got it backwards. Not being a great hunter. You know, one of those long things that shoot and hurt people, those things. That's it. I don't think a knife's in there. I respect Dr. Limehouse, but I'm not sure a knife is in that list. This is a big deal when it passed the legislature. I was a lobbyist for the Medical Association, and you know what my marching orders were. Don't you let that legislature interfere with us. So I'm pretty sure we had it stuck to gunshot wounds, but I don't remember knives. It may be amended since then. Dr. Roberts?
Steve, if I use either a landline or a cell phone, check the messages on my telephone at work, should I be having patients fill out one of these? I mean, I call my work number, the recording starts, I type in a code, and it flips to my voicemail.
Right. Well, these prohibitions all apply to something called a disclosure. And in HIPAA language, that means when that information leaves the covered entity. So incoming things you don't have to worry about. It's outgoing things.
But it's outgoing from my office recorder to my cell phone.
So you're talking about remote
Yeah,
listening.
I can check my messages from my cell phone to my office in Mount Pleasant and see if I need to fill in prescriptions.
Yeah.
Should I be having patients fill these things out?
Probably, because technically you've got a transmission that doesn't meet the HIPAA security standards. You know, the easy fix to all this is that we all use encrypted devices, which is probably where it's going, because cell phone use is about to overrun the ability, the bandwidth to handle it. I suggest this too, is that you have one or at most 2 people in your office who are responsible for all of the out-of-office communication that goes on, so that you don't have everybody in the office with access to this information. Because if you've got a small size office, you probably have 8 people working in that office, and if you got 8 people working in the office, it's going to be tough to police that, because everybody's curious. You know, it's just the nature of having all that information there. you're required by HIPAA to have this written thing called a description of privacy practices. And one of the things that ought to be in that description is how you protect all this stuff and what you're expecting the patient to do to help you protect it. That ought to be in your notice of privacy practices. Have you guys all gotten to the point where your patients come in and you say, you know, we got this thing called description of privacy practices. If you want it, you can have it, but just sign right here that says we showed it to you. Okay? That's kind of how it's starting to work. And it's not great because most of you have been smart enough to look at your privacy practices at least once a year and, you know, make sure it's updated and current. If not, the HIPAA police are getting weird because, you know, between the time HIPAA passed and about 2 years ago, everybody said, we've never had a HIPAA violation. We don't understand why this is so important. And then the next day in the Greenville News, you read that 800 medical records were found in an aluminum building behind a facility. And so it's an interesting thing, too. The way we got something called the South Carolina Physician Patient Records Act works like this. I was a lobbyist for the Medical Association, and I was very close to the fellow who was the chairman of the Senate Medical Affairs Committee. On a Friday afternoon, he calls me. He says, hey, you know anything about this doctor selling these medical records at an auction? I said, what? He said, yeah, a guy had been offered a job out of state. He tried to sell his practice. He was unsuccessful, and he just sort of panicked and had a big auction, sold everything in the building to a guy that runs a record service. Well, what's so bad about that? On Monday morning, there was an ad in the newspaper saying, I bought Dr. X's records. If you want them, you can come get it for $100 a pop. He said, here's the deal. You can either write a medical records law or I'm going to write one for you. So it was a long weekend for me, but we got that law, and that law is based on the pronouncements of the AMA. Dr. Limehouse was referring to them earlier about patient confidentiality and how patients ought to be involved in the disclosure of those things. Just for fun sometimes, if you think I'm fibbing about the AMA and HIPAA, look at the initial setup of HIPAA and compare it to the AMA's rules from the Committee on Ethical and Judicial Affairs. They're almost identical. So it's 2 out of the 3 laws we got because we were sort of involved, we, the physician community, in concerns about patient privacy. You know, the doctors were trying to protect patients' privacies. There are marketing prohibitions too. Do you guys market directly to your patients? Does the hospital market to patients on your behalf? And when they do, they use data that's coming out of your computers? They get their patient list from you? That's probably a violation. Not probably, it is a violation. Okay. Do you guys know about the vagaries of forwarding emails? You know the difference between forwarding an email and simply cutting and pasting something in a reply? If I reply, that's going to go with just the information that I've typed in back to the recipient. If I forward, it's going to have everything that's in the message that I forwarded. It's going to include things like, hey, that doctor you referred me to sucks, man. I don't know how he did that. So never forward a message. It's always a bad idea. You know, learn how to do a new email that says, this is what I want you to know. Okay? And look at the blind copy. Sometimes you accidentally hit reply to all, so the secret you're trying to keep from the patient gets sent right to them in the most hideous way possible because you're talking bad about the patient, thinking the patient's not part of the loop. So never hit reply all, never forward. And then, do you guys know what metadata is? You do? Okay, so in almost every either email or especially Word documents, there are codes that go into that document to tell Word what to do. There are also codes that go in there for secret recovery later on, like who typed the changes. And I say that because what is really putting data in the document is saying which computer was logged into the system that that person was sitting at. You don't know who the person was. So if you go back and you really want to do your partner over, send an email to somebody that's an amendment to what he's already sent, because the metadata will show it was typed at his computer or her computer. So there are programs that will clean all that up before you send it, and I strongly suggest you buy one of those programs that'll scrub all the metadata from everything you send out. Sometimes just for fun, you get a document from somebody else, especially lawyers, look at, just take your mouse, scroll the cursor over anything that's been deleted or anything in track changes, you know what I'm talking about? Track changes are on, just roll over one of those lines that's underlined, and you might see 4 or 5 iterations of that, and you might not be getting a completely original document. Okay. I never, ever would leave a message with somebody that says, return my call. Why? You don't know who's getting it. And it might be the wrong person who hears that. And we've talked a lot about patient's duty to help you out with this, but I think it's always important to remind them of it. And I talked about asking specific questions of vendors. So I'm going to stop. If y'all have any questions?